All right, good afternoon, and thank you all for being here. It should be pretty short, sweet, very straightforward. I'm joined here this afternoon with Dr. Jennifer Avegno, also Jeff Schwartz, who is our Director of Economic Development for the City of New Orleans, and I also asked our Director of Homeland Security, Colin Arnold, to join us this afternoon. We're here to give you an update, as I know you were expecting, as it relates to the impacts of the pandemic in our public health in the city of New Orleans. Throughout this pandemic, we have always made decisions based on data every step of the way, whether that is our case count, fatalities, positivity rate, hospital capacity, and the like. Always consistent. We're here doing the same thing. I'm having to move forward with putting further restrictions in place as it relates to the guidelines of the city. I know that earlier NOLA.com kind of put something out there prior to us finalizing things, a little snafu with the technology, but we got that straight. But the bottom line is nothing has changed even from what was put forward. We're just going to give you an official update from the city of New Orleans. Last week, our positivity rate was 5.5%. We've gotten our numbers for this week, and we're up 10.4%. You can't make it up. It's real, and it is now causing us to move forward with restrictions. Once again, we have seen a serious issue with community spread, and we also know that people have moved from their pods of family members to just bottom line socializing, and it is reflected in the numbers and in the data. Starting on Friday, January the 8th at 6 a.m., we will be restricting businesses all indoor capacity to 25% and limiting gathering sizes to that of your household. It is a critical point in the city of New Orleans, and we have to do what's necessary to flatten the curve, yes, a third time. Bars will continue to be closed as it relates to the state guidelines, but I will be allowing them to continue with the outdoor as well as the curbside. This will be in place for 3 weeks. So, over the course of the 3-week period, we will absolutely evaluate our progress, because that's what I'm hoping for. And again, if we're in a good place as it relates to the data, we will take steps accordingly. But there is good news. The vaccination absolutely is in the city of New Orleans. No, we do not have as many doses as we would like, meaning to cover our entire population of people, but every dose that comes our way will be utilized, and I am adamant about that. And also in terms of tracking our people who take the vaccination. So more to come from us on that. But please adhere to the guidelines that are in place. It is imperative. We have reached a point of community spread in our community that these actions that I'm putting forth in terms of restrictions are necessary and they are mandatory. Continue to wash your hands, wear that face mask, keep your distance. It is, again, imperative that we do so to save lives, to flatten that curve in our city, and to get back to operating as a city and loving on one another as we really want to do. So with that, I'm going to have Dr. Avegno come forward, and we'll move through our press conference. Steve, I like your haircut.
Thank you, Mayor, and happy King's Day. The mayor wore purple. I'm wearing green. We just forgot to ask Jeff to wear gold here. So, right. We find ourselves, as the mayor said, and as really everyone knows in the city, we find ourselves in a very difficult time. Every metric we've been tracking to see how the spread of COVID indicates a major community outbreak in New Orleans. As the mayor said, our percent positivity, both the way the state reports it and the way that we report it, have doubled in a week or not much longer than that. When you have a percent positivity rate of 10%, that means that when you are with 10 other people, it is highly likely that one of them will have COVID. We're averaging over 200 daily new cases, exponentially up from the average of 30 or so cases that we saw throughout many, many months. And, the more people that have COVID in the community mean the more people that will be hospitalized and ultimately the more people that will die. As you probably heard yesterday and today, the state broke a record for hospitalizations surpassing even what we saw here and in the state March and April during the stay-at-home order. All signs are flashing red. Now is the time to take immediate action. If we do not do so, it will cause needless preventable suffering and tragedy. When our data indicates an outbreak of this severity, we have to take mitigation action to reduce or eliminate the activities that have the highest risk of COVID transmission. So 2 months ago, when our case counts were very low, most indoor activities were allowed at 75%. As cases rose statewide, Governor Edwards reduced the capacity to 50%. As the parish percent positive rose above 5% for 2 consecutive weeks, as you know, bars and breweries were forced to close indoor. I think we were the last parish to be able to have indoor service. But today, where we are, we must take additional action. So as Mayor Cantrell said, we will begin a revised or modified phase 1 beginning this Friday. Gatherings and special events will not be allowed except for people who live together in a single household. All indoor activities reduced to 20% occupancy, that is all sectors. For sporting events, indoor and outdoor, and this is consistent with what it's been the last few weeks, they're at 4% of permitted occupancy. And tables, whether at restaurants, outdoor seating at bars or breweries, will be limited to 6 people. And everyone must be from the same household. You all know I'm an emergency physician, and being in the emergency department over the weekend, I saw more people admitted with COVID than I have since March and April. And they all had a variation of the same story. I was at a holiday party. I was at my family's house. I went somewhere with my friends. I found out that one person in the group was sick. Now we're all sick and one of us is hospitalized. This is every single patient, regardless of who they were or where they were from, told me that story. This is consistent with the data that we're seeing from the state and with what's happening around the nation. When I talk to health directors elsewhere, they say the same thing. Small gatherings of people from different households are the most significant source of spread right now. That's why we are limiting the gatherings to those in your household. If you do anything outside your home, please do it with members of those people that you live with, members of your household only. We want you to know that the policies that we're putting in place have 2 main motivators. Number 1, to preserve our hospital capacity that is already stretched. You have likely seen that many hospitals around the state and in our region are stopping elective surgeries again. That is a huge warning sign. We do not want to get to the point like Los Angeles where we have patients in the gift shop and in the hallways, because when that happens, our deaths will go up even more. The other priority is to get our kids back in school. Schools made a very difficult decision this week, the public schools did. They did not do it because what happens in the school is dangerous. They did it because the community is dangerous right now, and the community would bring the danger into the schools. And so as hard as it was to see as a parent and a public health professional, they did what they had to do to protect their kids and staff. This will be in effect, as the mayor said, for 3 weeks. Throughout that time, every day, multiple times a day, we are going to look at the data. We're going to talk to the state. We're going to do everything we always do. It is always available for you to see at NOLA Ready online. And so we need to improve to the point where our kids can begin to return to in-person learning, because that's what offers the greatest benefit to health and the economy. If trends are significantly improved in 3 weeks, we hope that will happen. And we hope we will be able to relax some of these restrictions. You know, if you take anything away from what we're saying, please let it be that you should not spend time with people outside of your immediate household right now. If you can work from home, work from home. If you have a play date, dinner party, sleepover, barbecue, visit to a relative, or other gatherings scheduled. And let me be clear, gatherings as we've defined them and as the state defined them are things like weddings and funerals and parties. Please cancel them, please reschedule. If you are an essential worker in particular, please make sure you wear a mask, please keep your distance, as much as possible. There is a light at the end of the tunnel with the vaccines, but the vaccines are only going to work for those who are alive to receive them. So on the subject of vaccines, I did get my second shot yesterday. I'm very, very honored and privileged. I'm feeling pretty good. My arm is definitely sore, and it was not sore the first time. I've had some body aches on and off in the last day. I've taken Tylenol, and I took ibuprofen another time, which helped. Talking to some of my frontline colleagues who are also now fully vaccinated, most of them have had the same experience, and we all agree. These minor side effects are nothing compared to what we see when patients are put on a ventilator with COVID, because we know how traumatic and devastating that is to patients and to their families. So I feel blessed because I am now protected from severe illness, but that doesn't change anything that I do. I am still wearing a mask. I am still fully social distancing because it's not yet clear if the vaccine will prevent me from catching a mild asymptomatic case and spreading it to others. I am not gathering with anyone outside of my household, even other family members. I'm glad that I'm protected, but like everyone listening, I want to make sure my family is protected. I'm really, really pleased to see the enthusiasm among our seniors this week who are now an eligible population to receive vaccine. I've spoken to many of them, and even those who were not able to schedule an appointment yet because of the limited supply are very excited about getting the shot in the weeks to come. Our healthcare systems have done a tremendous job at using every bit that they have and at expanding their capacity to schedule seniors. That's flowing much more smoothly than it did on Monday. So it's really, really excited. The vaccine is really our way out of the pandemic. So sleeves up, NOLA. It's going to be everyone's turn soon. But in the meantime, we have to get through this really critical period until we can all be together and do the things we love. Thank you.
Thank you. Dr. Begnaud, you want to just touch on the testing as well? The testing
Yes. Yeah, so our testing capacity remains robust. It's worth noting these higher numbers, a higher percent positivity is not because we don't have enough tests. We continue to have our community-based sites. We continue to have the National Guard testing. Our hospitals, urgent cares, clinics are still testing at a very, very high level, and that's going to continue. So please, we urge everyone, if you've participated in an unsafe activity, if you're feeling bad in the least, or if you just want to know because it really is everywhere, please come to one of our testing sites.